So surgical recovery, we're talking about approaches to surgical recovery. So collective approach. We're talking about different ways that we can approach recovery and healing. And we're also going to talk about signs to look out for in terms of any complications with surgeries. And we'll also just talk about some ways that we may feel when we go through surgeries or recoveries, and sometimes things that we might go through that impact our everyday life, our way of thinking, behavior, things like that. So let's have one more minute or so and we are going to jump right in. Awesome. So when we talk about surgical repair, what might come to mind in terms of what are different parts of the body that we might have surgery on? For example, so feel free to put it in the chat. But for example, there are surgeries where there might be a surgery. What does a surgery mean? It means to repair something. And ways that we can repair or parts of the body can be bones. It can be ligaments, tendons. They can tear organs. So sometimes there's might need a need for a transplant. That could be heart, kidneys. There can be heart surgeries. There can be cardiovascular surgeries. So different surgeries. Feel free to put it in the chat. Any surgeries that come to mind when you think about surgical recovery. You might even have a surgery related to the teeth, an extraction, and that's also considered a surgery. You might get some freezing, maybe wisdom teeth removal. Some cases you might be completely put under anesthesia and have the teeth removed. Any other thoughts around what might require surgery? Sometimes it's arteries or valves on the heart. So we're going to talk tonight about principles and strategies. I'm going to give you some tips on surgical recovery. As some of you might know, and maybe some of you logging in for the first time or will hear this at this episode at some point, you may know or may hear for the first time tonight. My name is Emma and I am the host of your show, Fitz Health Conscious Corner. And as much as practical and theoretical knowledge that I bring to the show, many aspects of the show that I do speak from is from experience. So lived experience that comes from navigating a rare cardiovascular condition. So I've had many surgeries. So some of you may know that. And some of those surgeries have been complete open abdominal aortic surgeries. So a surgery going all the way from my chest down my entire abdomen. I've had surgeries through the groins. I've had my wisdom teeth removed. I've had an appendix removal and I was airlifted to hospital when I had that appendix removal. So I've had many surgeries, and some of those I've had surgeries that's required a small incision for testing purposes. So there's different surgeries that we can have. And tonight we're going to just talk about so we're going to talk about some principles. We're going to talk about tips and strategies, but these tips and strategies you can apply to any surgery that you might have. So having this knowledge is not only helpful maybe for a surgery that you've had, it can be helpful navigating your life going forward. Maybe somebody that you might know that you might be caregiving for, or a friend that you might be helping out and just supporting that's gone through a surgery. So having some of this knowledge is super important. important. So just kind of circling back, I've had major surgeries. So I've had surgeries from minor surgeries to major surgeries, invasive surgeries to non-invasive surgeries. And many of them have had different aspects of challenge when it comes to those surgeries. So, we're going to talk about some of those things tonight. And feel free at any time, if you have thoughts that come to mind, questions that come to mind, put it in the chat, because I do want to hear from you and really get your perspective and your thoughts and feels on on any of the difficulties, or even just strategies that helped you to get through some healing times in your life. So for me, having multiple surgeries, I've had surgeries so many years and many different ages in my life. So sometimes you have surgeries that might impact your daily life. It might pull you right out of your routine. Some surgeries, you might have elective surgery, so it might be planned versus an emergency surgery. And so again, different reasons that you can have surgeries. So just gonna kind of touch on and speak from the lens of having major surgeries and some minor surgeries. So fun facts, right? What can we expect when having a surgery? So for one, you might have a surgery that requires you to have anesthesia. So, the good meds that knock you right out. So some surgeries you might have just freezing around the area, and you might be awake for those surgeries. I've had a couple of those too. So I've had surgeries where I actually couldn't be put under because of the risks of being put under. And I've had surgeries where I've had to be put out for about 8 to 9, 10 hours. And one thing that when you have anesthesia, what happens is when you're recovering, you might have a lot of low energy because you have had this medication. It sedates you, and it does take time to get out of your system. And depending on the surgery, how long of time that you have been under for, it will depend, and it will vary person to person. And so sometimes, you might notice that you're very fatigued and tired after surgery. And that's because of the sedation that you might have had. And also, when the body is trying to recover and repair itself, it does take rest. And when you're able to rest, the body's able to repair. So all the systems are able to start to work together to regulate each other and to be able to promote that healing in your body. So you might notice fatigue. Another fun fact is, healing, we might expect it to be this straight line upward, that, each day is a day in healing, but we might have these expectations that, we are of ourselves in the way that we think it should look like. So we might think that healing should look linear, straight line upward. And in reality, healing, as a fact, it's not linear. It's a wave. It's a wave of up and down. And that might be physical, it might be mental and emotional. So, and also when we talk about, when I specifically kind of have this approach to healing and recognizing and going through so many recoveries, I have learned each and every time more and more that healing is mind, body, and emotions and soul. So, just having, that understanding and having more compassion for myself and going through those recoveries to understand that I'm working really hard at healing and doing, it's self-discipline as well, having to be self-disciplined to go through the process of healing, and to have the patience and to recognize healing has to go at a different pace than you would regularly lead your life. So, slower pace, having to take more rest. And sometimes we don't realize how the need for rest is so important when you are recovering from a surgery, or just when you're recovering, period, whether it be something that you're going through emotionally, physically, mentally. So there are going to be good days and there's going to be not so good days. So times that we do feel that, you feel you're putting in all the work to heal, but then you might feel like you're not getting the results. And that's because we're looking at it, expecting it to be linear, when really it's going to be in waves. So, understanding that we're going to have days where you're going to feel more active, and then understanding there's going to be days where you're going to need to take that rest. Another fact about surgical recovery, pain medication. So, I've had to go through surgeries where I've been able to have pain medication, and then I've had to go through surgeries where in certain aspects of the healing and recovery, I was not able to take any pain medication. The reason being is pain medication, it can be very helpful, and it can be helpful to take it when prescribed, when needed. And part of that is judging and learning yourself and knowing when you need it or when you're relying on it. Now, some pain medications can be highly addictive as well. So I've had to go through different aspects of recovery with pain medication and without. And some side effects to pain medication, there can be many. So again, some can be addictive, some can cause constipation, some can have other effects, long-term use on other organs, kidney and liver. So having the awareness, when you're taking pain medication, that, for example, constipation, and it can be really heavy on the bowels, and there are ways. So if you are taking pain medication, you're noticing constipation, difficulty going to the washroom, so you want to be able to eat foods that are going to help promote movement. So what does that look like? It will look like high fiber intake, water, so hydrating. Might look like adding some prunes or prune juice to your intake. There are ways that you can. There's natural ways that you can help to promote more movement in your bowels, but you want to make sure that you're noticing if you are having any side effects to the pain medication. And also another thing to look out for is reactions, either to pain medication, new medication. Sometimes, often, when a surgery is done, often, depending on the nature of the surgery, but often when there is more of an invasive surgery, you're more than likely going to be put on some kind of blood thinner. And blood thinners, what they do, it helps to thin the blood and it helps to reduce the risk of clots. So after having a surgery, risk to clots is much higher. And that's why it's so important to take those medications if prescribed, those blood thinners, but also to look out for reactions to it. So you might, some signs of reaction could be rashes, it could be shortness of breath, fever. So there can be different ways that you might experience a reaction to medication. It's super important to contact, doctors, or depending on the nature of the reaction, getting medical attention right away. Also, you might notice changes in your appearance. So weight gain or weight loss, sometimes just noticing different changes in your body as your body is going through a recovery, a healing process. So it's really important also to be kind to yourself and to promote a positive mindset when you're in healing, because healing because it's having a surgery and going through healing can affect you in many different ways. It can affect, so as we spoke about, routine. For example, your ability to work. It might pull you right out of work and you might require some time to heal. Well, how can that impact you? It might impact your ability to take care of your basic needs. Sometimes that might look like grocery shopping, meal prepping, laundry, things like that. So it's important also to ask for help or utilize the help that's available to you and offered to you when you're going through surgical recovery, because doing basic tasks like self-care tasks, providing yourself with those basic needs we can think that it just requires a little bit of effort, but it takes a lot of energy. Even things like showering after surgeries and going through those recovery periods, it takes a lot of energy to do these things. So one thing that was really helpful for me is scheduling, times to go into the shower, time that I would prepare meals. So sometimes just not having the ability to prep for the meal and cook it right away. I'd have to do it in stages. Sometimes it meant, meal preparing, cooking in the morning, because that's when I have more energy as opposed to later on in the day. Sometimes it looks like ordering from a meal prep company, because you need to give yourself these healthy meals and meals that are promoting your healing. And sometimes the energy required to do it, you might not have that. So, and again, also, if you have that help available to you, where you have friends or family or, community groups that are able to help support you with some cooked meals and things like that, or, grocery store trips, or taking you to medical appointments, things like that, because all of these things are part of the process of healing, and they take up a lot of energy, and that's mental energy, physical energy, emotional energy. So you really want to be aware of that. Give yourself the grace and compassion, again, anticipating that going through recovery, you're going to anticipating some aspects of change. So that might be related to appearance, it might be related to your routine, it might be financial. So one of the things I can say, going through all of these surgeries, where some have just completely interrupted my life, they're not planned surgeries, and what I've been and experiencing, having a rare condition as well, but just understanding that for many of us, some people, you may have healthcare insurance, right? But not all things might be covered, or when you're going to work and then you're not working, all of a sudden you're not working, maybe not having those benefits that pay you when you're off. Sometimes some people may be self-employed, as well as like myself, right? So it's like I've gone through many shifts and changes where I've experienced financial hardship because I've been out of work because of multiple recoveries. So one thing that I have learned is the need to have the savings emergency fund, and being able to, when sometimes we look at our savings and you think, oh, that's only for goals, it's only for things that desires, wants, needs, investments, goals, but we don't realize that we need to, sometimes that savings has to be utilized for your healing and your recovery. And that is an investment in itself, because if you're able to give yourself the therapies that might be needed, the medications that might be needed, the rehab, or the just, having your bills paid and having a buffer to know that you have some savings to get you through some of those unanticipated times of illness, or just situations and circumstances that might pull you out of life and, affect your income. And just having a buffer, an emergency fund for savings for your health. It's super important. We might have, savings for education, for vacations, for a new car. We think of all of these things, but having a savings for your health is so important. And I can't stress it enough, because You never know when you will need, again, you might need physio and it's out of pocket expenses. You might need medications that are not covered. You might need to pay yourself for the time that you're not working. So it's really important to have a savings allocated just for those the emergency time that you might need it, whether it's sick days or just going through a surgical recovery. So it's really, really important that I can't stress that enough. There's so many times, right? And just going through many surgeries throughout my whole life, and then going through periods of working, multiple jobs, to going through periods of having nothing, not a single dime of income coming in, and having to utilize savings just to get through. So again, savings is not only just for those things that we want and need, and those vacations, the cars, the again, I'm not saying we shouldn't have that, want that, and want to invest and buy other things. But again, just knowing that putting the money into your own health, it helps you to be able to get to all of those goals, because if you don't have your health, you can't do anything else, right? You can't enjoy all of those things. So really, really important when it comes to that. And I see everyone joining in and all of the vibes coming through. So at any time, please feel free, put your thoughts in the chat. If you have questions, ask away, because this is why we're here. And it's so important. You never know when you can use this knowledge. The mind is this library, right? So the knowledge that you're taking in, putting it in your mind and being able to pull from it, because you never know in your life when you'll need it. So we talked about patience, slowing down, setting a good pace for yourself when you're going through healing and recovery, understanding that healing is not a straight line, it is a wave. So just giving yourself that compassion and grace to say that you're going to have good days, and you're going to have days where you're going to feel tired, going to feel low energy. It's going to impact your mood. You might be going through pain and you're tolerating pain and maybe not trying to take any pain medication. So, in those times we have to kind of learn to discern whether we need pain meds to help us to get through, whether we're just becoming reliant on it. Maybe there's more physical rehab that needs to happen. Maybe it's more rest. Right? Rest is the hardest thing to do. As much as we might think, sitting down after work is just resting is throughout the day, taking moments to just close your eyes, right? Just close your eyes and just breathe. That's helping to promote and put more rest in your body, helping your nervous system to respond to rest. Because when you go through pain, when you go through something that you feel might threaten your life or your ability, the nervous system can go through that fight and flight mode. And when we're in that mode, it can impact us in many ways. So you might feel increased stress, you might feel some mood, shifts, but having tools, strategies, compassion, awareness, it can help you to really navigate some of these things that come with going through recovery. And that can be surgical, it can be any type of recovery. So we also talked about scheduling, showers, baths, meal prep, laundry, energy that you might need to work on a project, whatever it is, or do some part-time work, whatever it is that you're doing, having a schedule just to schedule things in. So you can write things down. It can help you to check off, organize yourself, your thoughts, also to help you to shift things around to different days so that you're able to feel more that you're healing, you're managing your healing more. So as much as it might be difficult and feel like trials and tribulations, when you feel that you're being self-disciplined and you're taking charge of your healing, it does help you to feel more confident in your healing process and help you to promote more positive thoughts. Because one thing that comes with going through something that might take you out of your daily routine, like surgical recovery or illness, it can affect you mentally. So it can make you feel set back, discouraged. It might make you feel like you're losing out on time and missing out. And how you look at that is so important, because I can tell you, I've gone through surgeries where I have had recoveries that have been months, and then I've had surgery recoveries that have been years. And learning to explore my own thoughts, learning how to practice breathing, to meditate, really helped me to be able to sit in those positions where on my recovery bed, and I couldn't move as much. I didn't have a lot of mobility, but it helped me to really tap in and observe my mind and my thoughts and recognize what I'm feeding my mind. Positive thoughts, negative thoughts. Am I encouraging myself? Am I giving myself that compassion and grace that I would extend to somebody else going through that? Because sometimes we can be super hard on ourselves, harder on ourselves than anyone else, right? So again, really important to recognize, it's growing in self-awareness. That's what all of this is you're creating self-awareness just by doing all of these things. So it's practicing recognizing, for example, asking yourself, double checking with yourself, do I have the energy for X, Y, and Z today? Do I have the energy to do a full shower and wash my hair? Or do I need to do that in steps? Or am I meal prepping everything at the same time and cooking? Or am I breaking that out during the day, breaking it up throughout the day? Setting realistic expectations. Can I do all of these things and then still go out and do the groceries, still go out and, take care of other commitments, right? So just practicing as well, saying no, because you need to prioritize your own healing and your own rehabilitation and your, post-surgical needs, or just your recovery needs overall. So again, just to come back to some other things that we talked about was blood thinners, and we talked about risks to blood clots. So what are other ways other than blood thinners that you can make sure that you're reducing your risk to clots after surgeries, and anything that heavy impact injuries and things like that. So what can we do is we want to make sure that we're moving. So movement doesn't have to be big movement. It can be walking. Walking is very powerful in promoting blood flow and circulation in your body. So going through many of my recoveries, I have to keep on walking, right? That's one of the big things post-surgery, but also in my everyday life now as I navigate this condition without a treatment. Walking is what helps me to create blood flow and create more arteries, collateral arteries. So when you have surgery, or if anyone is having surgery, just you might notice as well, physiotherapists or OTs coming in trying to get the patients moving, and that's because circulation is so important and movement so important to be able to promote good blood flow, and to keep that up. Also, walking and movement has many benefits for the mind, the body, the emotional well. So, taking the opportunity, walking doesn't have to be far, right? It can be, you can walk around the block, you can walk up and down the hallway, different ways of bringing in movement into your life is really, really important when we're talking about promoting good health and in surgical or medical recoveries of any nature. So another thing that you might experience when you're going through surgical recovery, or someone you know might be going through that, is scar tissue. So what happens? What is scar tissue? So when the body experiences a surgery and an incision, the body's natural reaction is to rush to the surface. So it's like spider webs. So it's like a web, and the web forms and it pulls under the incision to pull all the skin together. So any surgery in the body, there's going to be some scar tissue because it's trying to heal itself, and that's what happens. So some things that happen with scar tissue can be pain. So what's important with scar tissue is movement. So stretching is super important. Breathing can be really helpful for reducing scar tissue. There are some procedures in new age technologies that help to break up scar tissue, that might be available for a need that you might have. However, a lot of the major surgeries, especially in cardiovascular nature, again, it varies person to person. But again, there's elements of scar tissue, some that can't be removed, and it's there all the time. But again, keeping yourself moving, keeping your body hydrated, breathing, using breathing techniques, it can help you to manage some of that pain. And again, stretching can help you to loosen scar tissue. So it's giving you more range of motion, flexibility, and really just, helping to hydrate the bones and the vessels. So, and that all works together with scar tissue. The body is all one. So it's a mind, body, and soul, collective. It's an approach, right? It's a collective approach to life and to healing and to recovery. So, what else? So what are some things to look for in terms of complications? So we talked about clots, but what else? Some other things that can happen after surgery, very important to look out for, is infection. So when you've had a surgery, your, again, risk to infection is higher. So you might have a wound that you need to take care of after the procedure, and that might be at home, it might be in the hospital. So some of what's very, very important when we're talking about wound care is cleanliness. So we want to make sure everything is sanitized. We want to make sure you're using gloves. You want to make sure that things are sterile, right? So if you're using gauze, if you're using Band-Aids, you want to make sure that when you're opening the Band-Aids, you're not facing it down on any surface. You're making sure that once you've opened the Band-Aids, you're putting it, or gauze, and you're taping anything on, that it's very clean, that it hasn't been on dirty surfaces or areas where it's picking up micro dirt and things that you might not be able to see. So you want to make sure that you're using gloves, you're using your alcohol swabs, you're cleaning the area, and you're using your bandages right away and putting it on the area, and making sure your hands are clean. You're washing your hands. If you're doing, you're taking care of the wound and you have to touch other things and taps and stuff like that, and you want to make sure you're washing your hands right away and before you go back and touch the wound, the compress, the area that you're going to be putting your compress on. So very, very important. So if the and again, after surgeries, doctors might put you on a medication to help you, again, to reduce the risk of infection. But if by any chance an infection does occur, what could that look like? So what that can look like is swelling, extreme redness, soreness, pain, fever. Sometimes a fever can happen because of an infection. So if you notice an infection starting to happen or some of these signs and symptoms, you want to seek medical attention right away. So contacting your doctor, going to your ER, making sure that infection is caught and is able to be treated. Get it treated, because it's super, super important when it comes to recovery and reducing risk for complications. And we talked about potential reactions to medications. So again, you really want to look out for that, be on top of those things. Growing in awareness. This is all about growing in self-awareness. And when you grow in self-awareness by utilizing this knowledge and having this knowledge, that helps you in every area of your life. So you'll notice a lot of this knowledge that we talk about every week is transferable into many different areas of your life. So I can say one more thing, and then maybe we'll start to wrap it up. But again, any questions, put it in the chat. Any feedback, comments, and I'll just scroll through. I really hope you're all getting something from this evening. So the last point I would say is stress. So a tip I would really stress to you is, pun intended, stress reduction. So we really want to make sure that, there's good stress when it comes to rehab and putting good stress on your body to promote strength, healing, and recovery. But when we're talking about extreme stress, where that is extreme rehab activities or workloads or stressful relationships, stressful environments, we want to make sure that we're limiting and reducing stress as much as possible. Why? Because stress restricts the vessels. So when you feel stress in your body, our body is this network of arteries that pumps blood entirely around the whole body. When you feel stressed, it does restrict the vessels. When the body feels the vessels are restricted, it can cause inflammation. It can cause a lot of complications and can add on and amplify some of the things that you're already going through. So it's very, very important, everyone, to mitigate stress, reduce it, focus on what you can control rather than what you can't control. Again, positive affirmations, promoting healing, positive words in your body. I am healing, my body's receiving this treatment. Having this dialogue in your mind helps to send these signals throughout your body. That helps you to reduce pain. It helps to relax the nervous system, and it helps you to feel more confident in your progress. As well. So, and then we also talked about diet, right? So just putting foods in your body that promote healing, live foods that give you energy, antioxidants, protein. So you want to make sure that you are getting the vitamins, the minerals that you need from your food to help you repair whatever it is, the area of your body that needs that healing, the repair, the recovery. So how are we feeling about all that we're discussing tonight? Any thoughts, feels, questions? So really what this all comes down to, everyone, it is mind, body, and soul emotion approach. So when we are promoting positive thoughts, when we're putting good fuel into our body, when we're giving ourselves that time to rest, to repair, when we are looking out for signs and symptoms of complications, that's all self-care. So when we're doing all of these things, we are able to promote optimal health, and we're able to promote recovery and healing in the body effectively, consciously. So we're promoting conscious living.